The West Africa Private Healthcare Federation, FOASPS, has achieved significant milestones over the past 2 years. This was thanks to the USAID-funded Journey Towards Sustainability G2SU grant. The present state of the Federation report aims to showcase the development and progress of the Federation, its key achievements, and its impact on the health systems landscape in West Africa. This report demonstrates the need for extended financial support or new funding for FOASPS to continue and expand its transformative work. FOASPS was founded in 2016 in Dakar under the presidency of Dr. Ardoba from Senegal. At its beginning, the association encountered some challenges, but a strategic turning point occurred in July 2019 with the election of the second executive board led by Mrs. Clara Omachiye from Nigeria. It has taken it upon itself to provide the organization with the resources necessary for its development. The USAID funding obtained in September 2022 following the response to a call for proposal made it possible to set up a permanent secretariat at the end of 2022. It is composed of international consultants with complementary expertise. Today, FOASPS is led by an executive board chaired by Dr. Joseph Bougifo from Côte d'Ivoire and brings together 11-member federations across West Africa. These country federations include Benin, Burkina Faso, Côte d'Ivoire, Ghana, Liberia, Mali, Nigeria, Senegal, Sierra Leone, and Togo. During the reporting period, the following results were successfully achieved. Creating the organizational development path, the implementation of tools and processes aligned with international standards, creating a modern governance framework enabling FOASPS to be a high-performing regional organization. The establishment of a strategic sustainability plan focused on resource mobilization, for-profit initiatives, and the provision of training and advisory services. Milestone submission. It should be noted that as part of the G2SU, 73.2% of the grant objectives were achieved. The implementation of key projects such as FOASPS services and the first operation of the Afrique Santé web television, as well as the success of many other initiatives, created the condition for organizational sustainability and commitment from partners and the public. Institutional coverage and influence. The growth in number of members from 9 to 11 country federations, with Niger and Sierra Leone onboarding in 2023 and 2024. The positioning of FOASPS as a strong partner with the West African Health Organization and the African Health Federation as one of the most viable regional voices of the private health sector. Establishing strategic partnerships. Cooperation agreements have been signed with key entities including WAHO, organization responsible for the promotion of regional health policy in the West African sub-region. ARC, institution active in promoting the improvement of health commodity supply chains in Africa. Leader Expo, co-organization with FOASPS of the African Medical Tourist Congress. High-impact initiatives for FOASPS sustainability. It is worth mentioning the establishment of FOASPS services, the realization of important contracts with clients as FHM Engage to support the Health Federation of Liberia and Madagascar, the World Bank to facilitate a staff retreat, and ARC to support the CNSS Djibouti in the design of the regional pharmaceutical hub and the staff training. Thus, FOASPS services mobilized a turnover of little more than 5% of the G2SU. Afrique Santé Web TV initiative, it has proven to have a great potential for communication, visibility, and profitability for FOASPS and its partner. It is built around a business model that brings the media closer to the target. Afrique Santé Web TV team gained from 2 international events to produce more than 50 TV shows, conferences, live broadcasts, and so on. Advocacy action on health policy. These are carried in international event activities and meetings. For example, the first high-level policy conference in 2023 on public-private dialogue promotion to advance universal health coverage in West Africa. During this period, working on FOASPS vision, significant impact have been recorded in terms of transformative health dialogues. The high-level political conference held in July 2023 brought together more than 300 delegates and 15 exhibitors, setting a precedent for collaborative policy making. The African Medical Tourist Congress AMTC5, held in November 2024, gathered 650 delegates and 40 exhibitors. In terms of economic and financial contributions, the support of the country federations, thanks to the G2SU sub-grant, has enabled them to base their growth on the model of theory of change. FOASPS training and advisory services have not only strengthened the capacity federation in Benin, Côte d'Ivoire, Madagascar, Mali, Niger, Liberia, and Togo in health sector development, but have also generated revenue for FOASPS. In terms of contributing to regional integration, membership growth and strategic partnership have put FOASPS in a strategic position for health innovation and collaboration in West Africa. Empowering women and youth. FOASPS is launching its project incubator after a first trial during the African Medical Tourist Congress in Abidjan. The first edition was a success, with 3 project winners out of 8. Students got the opportunity to participate in a competition game and pitch their projects on technology in health, medical tourism, and supply chain. The first prize was for a project on health technology developed by 2 young female students. While the accomplishments are brilliant, there are a few concerns that should be considered challenges for FOASPS and its partners. These include funding gaps, limited opportunities for regional grants, and the need for scale-up operations. The G2SU grant did not achieve long-term self-sufficiency. Additional funding in the form of an extension for a new grant is essential to sustain progress and keep on strengthening the private health sector. Although the Permanent Secretariat has made a serious commitment to respond to calls for proposal, requests for proposals from multilateral organizations prioritize national responses over regional approaches. FOASPS, therefore, plans to diversify its strategy with the submission of spontaneous funding requests and the search for strategic collaboration projects with its partners. Pilot initiatives such as FOASPS services and Web TV require dedicated resources and staff for large-scale implementation. Access to new funding will support this strategy of mobilizing human resources. In terms of outlook, the future is very promising for FOASPS if the following actions are taken appropriately. Strengthening growth initiatives through membership. This will involve expanding FOASPS to Cape Verde, Gambia, Guinea, and Guinea-Bissau. Formalizing the creation of FOASPS services as a joint stock company. The pursuit of innovative projects. This will include emergence for Afrique Santé Web Television with the finalization of partnerships, recruitment of technical teams, and acquisition of equipment. The long-term ambition is to become a leading communication for the health sector in West Africa. There will also be a point for formalizing and starting the Investors Club with the mission to promote private investment in West Africa health service companies and beyond. Regional leadership. It is necessary to strengthen partnerships with WAHO, HHF, ARC, and other regional bodies to advance the shared goals of promoting sustainable and resilient health systems in West Africa, as well as support the creation of similar federations in Central and Southern Africa under the MOU with AHF. FOASPS transformative journey from a fleeting federation to a key player in West African health sector underscores its potential for even greater future impact. However, maintaining and expanding these successes requires continued investment and strategic support. For all stakeholders, partners, and potential funders, this is a pivotal moment. Your support can ensure that FOASPS continues to ensure organizational and financial sustainability of the private health sector, encourage knowledge sharing, drive healthcare innovation, strengthen regional integration, and bring lasting wellness benefits to the people of West Africa.